What is a Medicare Advantage plan? That is exactly what we are going to cover today. Hi, my name is Jo Hutchison, and I am an independent health and Medicare broker with Founders Life and Health here in beautiful St. Louis, Missouri. And today we are going to be looking at Medicare Advantage plans. What are they? How do they work? What are the pros? What are the cons? And hopefully answering some of your questions. You have probably seen a ton of commercials, especially if it's the fall, about Medicare Advantage plans and all of the extra benefits that you receive. I personally think a lot of those commercials can be a little bit misleading, which I wanted to do a little bit more of a deep dive as far as how Medicare Advantage works and talk a little bit about what those commercials are really saying. So, first and foremost, what exactly is a Medicare Advantage plan? It is an alternative way for you to take your Medicare instead of just original Medicare Parts A and B. You may have heard of Medicare Part C. Medicare Advantage plans and Part C are the same thing. Medicare Advantage plans are managed by private insurance companies. So when you see all those commercials, you see different companies that are advertising their specific Medicare Advantage plan. So because a Medicare Advantage plan is run by a private insurance company, the way that it works is, for example, if you go to see your doctor, or if you have tests done, or even if you have a hospital stay, the doctor that you see or the hospital that you see will bill the Advantage plan carrier directly. And then anything that is your cost sharing afterwards will come to you. So that will be your deductible, any co-payments that you have, or any co-insurance that you have, what's agreed upon within your Medicare Advantage plan. So what are the advantages of a Medicare Advantage plan? Well, the first advantage is that everything is going to be bundled all together. So that is often even going to include your prescription drugs. Depending on the Advantage plan, most of them will include your prescription drug coverage. Another pro to an Advantage plan is that there is an annual maximum out of pocket. So every plan is going to be a little bit different, but the 2021 max for all plans is going to be $7,550 for the year. Now, other plans are going to be lower than that, but the max that the government says can be for any plan is $7,550. I have several clients that are on plans with much lower maximum out of pockets that are going to be more in the $2,000 to $3,000 range for the annual. And that is where all of those co-payments, co-insurance, and deductible get lumped together. Another pro to a Medicare Advantage plan is that they are often very low monthly premium or zero monthly premium. That can be very appealing to somebody that is on a monthly budget, that they want to keep their monthly premium costs low on their health plan. One of the biggest pros to a Medicare Advantage plan, and what a lot of my clients like the most about it, is all of the additional benefits. That's those things that you hear about in those commercials all the time. That's what they're advertising to you. So it'll wrap your dental in with the plan. Vision is included in the plan. There are often gym memberships included in the plan. There are often over-the-counter benefits where on a quarterly basis, they'll give you, say, around $100 to buy aspirin and mouthwash and all the things that you would generally buy at a pharmacy. So when you see those commercials and they're advertising all those additional benefits to you, that's what they're talking about. They're talking about the adding in the dental, vision, gym memberships, all of those types of things. So what are some of the cons of a Medicare Advantage plan? One of the biggest cons of a Medicare Advantage plan is that they are often network plans. They are going to be HMO or PPO plans that you have to stay in network, so you'll have to see certain doctors. That can be a little bit restrictive if you travel a lot. People that I have, a lot of my clients that travel more, that want to be kind of all over the country, or they're snowbirds, the Medicare Advantage plan isn't going to work for them as well because they would have to travel all the way back to where their original doctor is to be able to use any of their benefits. Another con to a Medicare Advantage plan is that the doctors that contract with these plans sometimes can move in and out of the plan throughout the year. So If you start off with your doctor in the Advantage plan, say January, February, March, but for some reason they decide to move out of the plan, then suddenly you can find yourself in April where that person is no longer in network. So that's kind of a bummer. Another con to a Medicare Advantage plan is that a lot of times if you have a bigger service required, say it's going to be a surgery or something, the network providers are going to require prior authorization. So they're going to have to get in touch with the Advantage plan and make sure that they will cover it before they will proceed with the procedure. So that it's just an added piece of bureaucracy to throw in there, which can be kind of annoying. Things to remember if you decide that a Medicare Advantage plan is right for you. First and foremost, you will no longer be using your Medicare red, white, and blue card. You will be issued a new card that's a Medicare Advantage plan card from the carrier that you choose. Second thing to remember is that you have to be enrolled in Parts A and Parts B. So if you haven't enrolled yourself in Part B yet, you'll need to do that before you can sign up for a Medicare Advantage plan. Third thing to remember along the same lines is that you will have to continue to pay your Part B premium. So you have that premium every month that you have to pay for your Part B. You will have to continue to pay that every month. The next thing to remember is that a Medicare Advantage plan is going to use in-network doctors. So I know we just talked about that, but it's something really important to remember. If you need to go out of network to get care, it is likely going to cost you more as far as co-payments, co-insurance. The next thing to remember is that Medicare Advantage plans are going to be completely different based on where you live. Every zip code has different available options. So when you're talking with a broker about what options are available to you, they're going to need to know where you live so that they can look up those options specifically for your area. The next thing to remember is that Medicare Advantage plans are calendar year plans. So they change every year, January to December. Usually about sometime in September or October, you will get an update from the carrier that you use letting you know about any planned changes that they have for your plan that are going to take effect in January of the following year. Along those same lines, because of some of those changes that happen calendar year to calendar year, you have the option during the period of time that's called AEP, or the annual election period, which runs from October 15th to December 7th. During that time, if you want to make a change to your Advantage plan, that's the time that you can do that for the following year. There's one other time of the year that you can make changes to your Medicare Advantage plan, and that is during what they call OEP, which is the open enrollment period. During that time, you can do one of two things. You can either switch from the Advantage plan that you have to another Advantage plan, or you can switch from your Advantage plan back to original Medicare. As you're getting more information about Advantage plans, be sure to talk to a Medicare advisor that can advise you on what is going to be best for your needs and for your budget. You can always feel free to reach out to us here at Founders Life and Health. We work with Medicare Advantage plans and with Medicare supplements, and all of our services are 100% free for you.